I'm Dr. Nicholas Ting, and I'm fellowship trained in anterior hip replacements. Anterior hip replacements involve approaching the hip from the front of the hip as opposed to the back. And what initially got me very interested in it was that we do go between the plane of muscles and nerves in the hip as opposed to through muscles. Now that has tremendous implications as it relates to not violating some of the muscles that stabilize the hip, and also has implications for a faster and easier, more pain-free recovery in the beginning of your recovering stages. We involve X-ray throughout our procedure so that there are no surprises, and also because the use of intraoperative X-rays allows us to confirm our component positioning of the hip replacement before we leave the operating room. Very soon, we'll be able to bring robotic-assisted techniques to anterior hip replacements. We're already doing it in the setting of partial and total knee replacements with tremendous success, and we look forward to be able to bring that and marry it to anterior hip techniques. There are a lot of ways that we can measure success in orthopedic surgery. We can measure angles of how much people are bending, how quickly they get off canes and walkers, but I think the best measure for me are the stories that I get from my patients. Whether it was getting that championship racquetball player back to championship form, or getting that mom back to taking care of her kids and being able to run around with them during soccer practices, that to me ultimately is the best measure of success. I think the most important part about picking your hip surgeon is picking a surgeon that is comfortable with the approach that they use the most. And that ultimately winds up being the biggest determining factor of your success. At the end of the day, I do believe, and I tell all my patients this, that at 6 weeks following a hip surgery, a well-done hip replacement is a well-done hip replacement no matter how you did it. I find hip replacement surgery to be one of the most rewarding aspects of my career, and that's because I get to get patients back to their passions, whatever that may mean. And certainly with advances in techniques, including anterior hip replacements and improved post-operative recovery pathways, I look forward to bringing you back to whatever it is you want to do in this game of life.